Basic anatomy. Body systems. In this material, students learn about various human body systems. For example, the skeletal system, which includes bones, joints, and ligaments. The muscular system, which includes types of muscles, skeletal, smooth, and cardiac, and their functions. The nervous system, which includes the brain, spinal cord, and peripheral nerves. The circulatory system, which includes the heart, arteries, veins, and capillaries. The digestive, respiratory, reproductive, excretory, and endocrine systems. Further explanation of the body systems in basic anatomy. The human body system is a collection of organs that work together to carry out certain functions. Here are the details of each body system. 1. Cardiovascular system. Its main function is to transport blood, oxygen, nutrients, hormones, and metabolic waste throughout the body. 1. Main components. Namely, heart, whose function is to pump blood throughout the body through systemic and pulmonary circulation. Consisting of atrial and ventricular chambers. And valves such as the mitral and tricuspid valves. Blood vessels consisting of arteries, veins, and capillaries. Arteries whose function is to carry oxygenated blood from the heart to the body. Veins whose function is to carry deoxygenated blood back to the heart. Capillaries whose function is as a place for the exchange of oxygen and nutrients with body tissues. Cardiovascular system detailed explanation. 1. Main function. The cardiovascular system is responsible for transporting oxygen, carbon dioxide, nutrients, and hormones throughout the body. Helps remove metabolic waste. Regulates body temperature and maintains fluid balance. 2. Main components. 1. Heart. Structure. Shaped like an inverted cone, located in the thoracic cavity. Slightly to the left. Consists of 4 chambers. Right atrium receives deoxygenated blood from the body through the vena cava. Right ventricle pumps blood to the lungs through the pulmonary artery. Left atrium receives oxygenated blood from the lungs through the pulmonary vein. Left ventricle pumps blood throughout the body through the aorta. Heart walls, epicardium, protective outer layer. Myocardium, the layer of heart muscle responsible for contractions. Endocardium, smooth inner layer. Cardiac conduction system, sinoatrial, SAW, node. Main pacemaker that initiates the heartbeat. Atrioventricular, AV, node. Delays the impulse to ensure that the atria and ventricles contract in sync. 2. Blood vessels, arteries, carry blood from the heart. Have thick walls to withstand high pressure. Veins, carry blood back to the heart. Equipped with valves to prevent backflow. Capillaries, small blood vessels where oxygen, carbon dioxide, and nutrients are exchanged with body tissues. 3. Blood composition. Red blood cells, erythrocytes, carry oxygen. White blood cells, leukocytes, fight infection. Platelets, thrombocytes, help blood clot. Plasma, fluid that transports nutrients, hormones, and waste. 3. Blood circulation process. 1. Systemic circulation. Starts from the left ventricle, right pointing arrow aorta, right pointing arrow arteries, right pointing arrow body tissues, right pointing arrow veins, right pointing arrow right atrium. 2. Pulmonary circulation. Starts from the right ventricle, right pointing arrow pulmonary artery, right pointing arrow lungs. Gas exchange in the alveoli. Right pointing arrow pulmonary vein, right pointing arrow left atrium. 4. Heart and blood pressure regulation. Heart rate. Controlled by the autonomic nervous system, sympathetic and parasympathetic. Influenced by factors such as physical activity, emotions, and hormones, adrenaline. Blood pressure depends on the strength of the heart contractions and the resistance of the blood vessels. Normal blood pressure, 120/80ths of a millimeter of mercury. 5. Clinical application. 1. Cardiovascular diseases, hypertension, high blood pressure due to narrowing of the blood vessels, atherosclerosis, buildup of plaque on the walls of the arteries, myocardial infarction, heart attack, blockage of blood flow to the heart muscle, heart failure, inability of the heart to pump blood effectively. 2. Diagnostics. ECG, electrocardiogram, detects the electrical activity of the heart. Echocardiography uses ultrasound to view the structure and function of the heart. Blood tests measures levels of cardiac enzymes such as troponin to detect heart damage. 3. Therapy and medications. Medications, such as beta blockers, ACE inhibitors, or statins. Surgery, such as heart bypass or stent placement. Cardiac rehabilitation. Exercise and diet programs to help recover from a heart attack. 2. Clinical application. Blood pressure check to determine the function of the heart and blood vessels. ECG, electrocardiogram, to detect heart rhythm disorders. 2. Respiratory system. Main function. Provides oxygen to the body and removes carbon dioxide. 1. Main components. Respiratory tract. Nose. Pharynx, larynx, trachea, bronchi, and bronchioles. Lungs. Contains alveoli as a place for gas exchange. 2. Clinical application. Spirometry to measure lung capacity. Radiology examination to detect lung infections such as pneumonia. Detailed explanation of the respiratory system. 1. Main function. The respiratory system is responsible for exchange of oxygen and carbon dioxide gases between the body and the environment. Regulating acid-base balance by controlling carbon dioxide levels in the blood. assists in producing sound, phonation. 2. Main components. 1. Upper respiratory tract. Nose. Functions as an air entry point, humidifies, and filters particles through nasal hairs and mucosa. The nasal cavity warms the air before it enters the lungs. Pharynx, throat, common channel for food, to the esophagus, and air, to the trachea. Larynx, voice box, contains the vocal cords that produce sound when they vibrate due to airflow. Protects the lower respiratory tract with the epiglottis, which closes when swallowing. 2. Lower respiratory tract. Trachea, windpipe, a tube-shaped airway lined with cartilage rings to maintain its shape. Bronchi and bronchioles, the main bronchi branch into the left and right lungs, which then branch into bronchioles. Functions as an airway to the alveoli. Lungs, located in the thoracic cavity, consisting of 2 lobes on the left side and 3 lobes on the right side. Contains alveoli, where gas exchange takes place. 3. Alveoli, a microscopic sac-like structure surrounded by blood capillaries. Has a surfactant layer that prevents the alveoli from collapsing. 4. Respiratory muscles. Diaphragm, the main muscle that helps expand and contract the lungs during breathing. Intercostal muscles, helps the movement of the ribs during breathing. 3. Breathing process. 1. Ventilation, airflow, inspiration, inhaling. Air enters the lungs as the diaphragm contracts and the chest cavity enlarges, creating negative pressure. Expiration, exhaling. Air exits the lungs as the diaphragm relaxes and the chest cavity shrinks. 2. Gas exchange. In the alveoli, oxygen diffuses from the air into the blood. Carbon dioxide diffuses from the blood into the air to be exhaled. In body tissues, oxygen diffuses from the blood into the body's cells. Carbon dioxide from body cells diffuses into the blood. 3. Gas transport. Oxygen, transported by hemoglobin in red blood cells. Carbon dioxide, transported in the form of bicarbonate, dissolved in plasma, or bound to hemoglobin. 4. Respiratory regulation. Respiratory center, located in the brainstem, medulla oblongata and pons, which controls the rate and pattern of breathing. Chemoreceptors, respond to carbon dioxide, oxygen, and blood pH levels to adjust the respiratory rate. 5. Clinical application. 1. Respiratory diseases, asthma, narrowing of the airways due to inflammation, making it difficult to breathe. Pneumonia, lung infection that causes inflammation of the alveoli and fluid buildup. COPD, chronic obstructive pulmonary disease, chronic disease that reduces airflow, such as emphysema or chronic bronchitis. Lung cancer, growth of abnormal cells in the lungs due to smoking or exposure to harmful substances. 2. Diagnostics. Spirometry measures lung capacity and airflow to detect disorders such as asthma or COPD. Chest X-ray checks for abnormalities in the lung structure such as infection or tumors. Arterial blood gas test measures the levels of oxygen, carbon dioxide, and pH in the blood. 3. Medications. Inhalers. Medications that help open the airways, especially for asthma. Oxygen therapy. Given to patients with low oxygen levels. Respiratory rehabilitation. A program of exercise and breathing exercises to improve lung function. The respiratory system is essential to everyday life.